Good afternoon, everyone, and welcome to today's podcast, Industry Matters Respiratory Edition. I am Boone Lockard, VP of Clinical Services here at VGM. The podcast today is sponsored by Fisher Paykel. We have Michelle Douek on the line. Michelle, if you could tell us a little bit about yourself, and I'll jump into some questions.
Yeah, happy to. Thanks, Boone. So my name is Michelle. I'm a product manager here at Fisher Paykel, and I specialize in home humidification for medically ventilated patients. My role mainly involves supporting product development, bringing these essential products to market, and driving our marketing efforts to ensure that our patients receive the best possible humidification for their respiratory health.
Michelle, explain to our audience, and we're getting back to the basics here. Explain to our audience, what is a humidifier? What does it do, and what's its function?
A respiratory humidifier is a device placed between a ventilator and a patient that is used to heat and humidify the air delivered to that patient, be it room air or dry cold medical gas. But to fully appreciate the impact that adding a humidifier can have, let's take a step back and talk about the main functions of our upper airways, of which there are three: to filter, to warm, and humidify our inspired air. In a healthy person, the upper respiratory system does most of the heating and humidifying of our breath. A healthy airway has no trouble heating and humidifying that breath to what we call optimal humidity levels, which is 37 degrees Celsius and 44 milligrams per liter, the conditions your breath should be when they reach your lungs. However, if an upper respiratory airway is not performing optimally for a compromised patient with a genetic condition or an illness such as COPD, or if the upper airway is completely bypassed, like for a tracheostomy patient, the respiratory system needs that assistance to heat and humidify and filter those particulates. And our humidifiers are added to that ventilator setup between the vent and the patient to add that heat and humidity into their therapy. And adding an FMP humidifier really does help reduce the work of breathing of these patients. This way, their bodies don't have to work as hard. Adding heat and humidity to a respiratory system that maybe can't achieve those optimal humidity levels by themselves means their system now can be more heated and humidified, which should increase comfort, help their natural defense systems, such as their mucociliary transport system, and be more effective and maintain those optimal functions of the airway.
So you had referenced optimal humidity there, the 3744. How is the humidifier typically used, and what does it actually do for the patient? You touched on it a little bit, but can you go into a little bit more detail?
Yeah, of course. So when suboptimal heat and moisture is delivered to that patient, there's a progressive slowing of our natural defense system, like the mucociliary transport system that I just spoke about. And therefore, that patient will have an inefficient airway defense as well as likely having inefficient gas exchange in their lungs. So, for those compromised patients, it can be difficult for their respiratory tract to really add that appropriate heat and moisture when breathing. And that's where the humidifier comes in. It reduces that work of breathing for them and better balances the heat and moisture in those patients.
Obviously, a humidifier sounds like it's an integral part of the ventilator setup. Is it used currently on all vent setups, or are you seeing this in the market that providers are using them on all of their patients? Is my first question I would ask. And then, what humidifier do we use?
Yeah, so it's unfortunately not used on all vent, but we do believe that humidifiers are an integral part of that vent setup for the patients. And adding in that device, like I mentioned, helps reduce that work of breathing for those patients while increasing that heat and humidity in their system, which is really a win-win for the patient at the end of the day. And many physicians and RTs do agree, which is why it's included in many home ventilator setups, but not necessarily all. And at FMP, we're always innovating. So we do have a few humidifiers out in the market at the moment. The HC550, it's been around for quite some time. It's used for adult invasively ventilated patients. And we have our MRA10 humidifier, another great device, and that is used for adult non-invasively ventilated patients.
So you've mentioned the 550 and the 810, but being at some of the trade shows over the last few months, I've seen a new product as well. That's what we're really here to talk about is the new product here and what FMP has brought from a humidification perspective. Tell us a little bit about the 820.
Yeah, I'm glad you asked. So I'm really excited to talk about this today. So we just released our new FMP My20 system. It's our newest humidifier offering, as you mentioned, for the home and the LTAC space.
What patient groups and therapies does the My 820 system support?
Yeah, so this is really exciting because the FMP My 820 system is designed to support both adults and pediatric patients, as well as it supports the delivery of invasive, non-invasive, and humidified high flow therapy. It comes with 4 settings. We recommend usually settings 1 to 3 be used on NIV patients, 3 and 4 for high flow patients, depending on their comfort levels, and then setting 4 for those invasively ventilated patients. So this is truly your universal solution for respiratory humidification at home, allowing for that simplified inventory management, 1 device, 2 patient populations, 3 therapies.
I love it. And so you touched on some of the settings of the new product, but are there any other features with the new device being the My 820?
Yeah, there are quite a few. So the My 20, first and foremost, maintains a simple design, only 2 buttons on the face of the humidifier base, that standby button that you use to turn on and off the machine and pause any audible alarms, and then a settings button to toggle between the different temperature settings. And we've also updated the alarm symbols on the heater face to make it easier to identify the cause for an alarm.
So that's one thing we wanted to touch on as well, just being the different alarms with the My 820 system. Tell us, the audience, a little bit more about those alarms.
Yeah, so this is a bit different in the home care space. Our engineers have designed a new intuitive alarm system. We've updated the software of the humidifier base to help identify the cause of the alarms, as well as implement 2 types of alarms, right? So we have a low priority alarm, which is a visual only alarm. We'll display a solid yellow light under that relevant symbol on the humidifier base. And then you have a medium priority alarm, which is both a visual and an audible alarm to indicate a more serious issue that may need more immediate attention. For example, a chamber running out of water. No water, no humidity. And so, with upgraded intuitive alarm systems, the My 20 software can detect that the chamber is running out of water. And when it's nearly out of water, the alarm on the faceplate will actually light up as a low priority alarm to start with. And then, if the alarm is not resolved after a certain period of time, it will then trigger that medium priority audible alarm. But once this chamber is refilled, the alarm will resolve once the software detects those higher water levels.
It amazes me, and we've talked about this before, but it amazes me the amount of technology that is actually built into a humidification system. And F&P has been the market leader of these products for many years, well before my time, that's for sure. But what other features does the My 820 system have?
So the My 20 system, unlike our current humidifier offerings for invasive patients, does not require an external temp probe or heater wire. Our engineers have enhanced that sensor software and algorithms in the My 20 to better adapt to temperature changes. And so the system has multiple data points that feed into the heater's algorithm to control the heater-based outputs, which is then precisely calibrated to predict the temperature at the distal end of the circuit. And the algorithm combines these output data and system feedbacks via the ambient temperature sensor and heater plate temperature to ensure the intended humidity levels actually reach the patient and then reduce condensation. And so the system works best with My 20 circuits in chamber. Because of these upgraded software features, there is now an integrated heater wire adapter and sensor. This then allows the My 20 to deliver high performance outputs without the need for those additional temp probes. And so no probes, meaning a simpler setup for users and reducing the number of wires around the device.
This is amazing. So we've covered a little bit about pretty much the whole gamut of humidification, from the necessity for a humidifier on all of your patients and decreasing work of breathing, what optimal humidification is, a lot of the perks and advantages to moving to the My 820 system. Is there anything else for the audience here that you'd like to cover and close us out with?
We've had great market response for the F&P My 20 system. It's really resonating with a lot of our customers, especially in the pediatric space, allowing for that simpler setup that's easier not only for the RTs but for the caregivers to manage at home as well. And I would always encourage for those who are interested to check out our website and contact their local sales representative to learn more.
Well, Michelle, we appreciate your time and Fisher Paykel for sponsoring today's podcast. Appreciate you teaching us more a little bit about humidification and the My 820 product, and I'm sure the audience is excited to see it out in the field as well. So thank you.
Yeah, thank you.